This didactic content is intended for global training and educational purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local, or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. Please discuss these as well as risks and benefits of this procedure with your qualified healthcare professional to determine whether this procedure is appropriate for you. Our originally scheduled moderator, Hamish McNair, will be unable to join us for this evening's program, but we are fortunate to have Dr. Kanika Patel-Shalan, VP of Clinical Operations and Medical Director at Candela, joining us as the moderator of this event tonight.
Thank you, Grace. And again, good evening to everybody. Thank you so much out there who has joined for Dr. Ahnudt's webinar, Optimizing the Active. We encourage you to type questions into the chat, and we're very pleased to welcome Dr. Cordula Ahnhudt-Franke to give this webinar. She is a consultant dermatologist with a PhD from the Department of Dermatology from Charité Berlin. And Dr. Ahnhudt-Franke specializes in aesthetic dermatology and laser medicine. And she's actually located on the beautiful island of Mallorca, Spain. Her practice is called My Skin, and she's been running that practice since 2002. So it's lovely to have you here this evening. Thank you so much, Dr. Cordula. And I will, with that, stage over to you.
Thank you so much, Konika, for the invitation. I'm really excited to present this webinar today about active acne. And in the next hour, I would like to share with you how a fantastic and effective treatment approach using the Nordlys laser has helped me to take the treatment to a new level of satisfaction for the patients and ourselves. So being a dermatologist for 20 years, we do find acne quite a challenge, quite a therapeutic challenge. What makes the treatment so difficult? I think one of the main or one of the important things is acne is a real dermatological disease. Yeah, so it's often misdiagnosed. It's often underestimated as well. And acne is such a common disease that everyone feels like an expert in its treatment. So mainly the patients, the parents, their friends, social media, beauty therapists, doctors of all specialities. So there is quite a lot of going on, in the treatment without many standards. Also, acne is a disease which requires a quite long course of treatment. So it requires patience. And as we deal with a lot of young people, teenagers, this is not the greatest thing. They are in a time of their lives where they expect a lot of miracles and really great and fast results. And this is sometimes difficult to guide them through the course of the treatment. So before we go into the treatment approach, I would like to share with you quickly the pathophysiology, because I think this is very important to understand as we understand better the treatment itself. So acne is an inflammatory dermatosis. Yeah, this is really important that we always remind ourselves about that. We have a couple of different pathophysiological factors. One is the overproduction of sebum that we find in the sebaceous glands. So usually this overproduction of sebum starts in puberty, earlier than ever sometimes, in age of 11, 12 even. It's not a hormonal problem. It's mainly just a hypersensitivity of the sebaceous glands that purely overproduce sebum, which then blocks the sebaceous gland, the excretory ducts, and this leads to a dilation of the ducts. And in addition to this, we find a perifollicular inflammation and a follicular hyperkeratosis. So, and it's the best cannon fodder, you know, of course, for bacteria. Our skin is not sterile, so we have a bacterial colonization, which have a lot to eat with all this overproduced sebum, which will then lead to inflammatory processes, and depending on the level, on the depth of this inflammation, we find different lesions. So let's go, let's go into the single lesions. This is very important. So maybe you remember the efflorescence theory from university, or when you are a dermatologist, you are familiar with this, of course. We differentiate closed comedones, so white heads, from open comedones, from black heads. And then once bacteria are involved, we find papules, pustules, or the combination of both, the papular pustules and even cysts. So in many types of acne, we see the simultaneous appearance of different lesions, but this always guides us to the right diagnosis of the type of acne. So today I would like to focus on the juvenile acne, which is what we see most in our clinic in Mallorca. So we differentiate between 3 different grades. So one is mild acne, where we mainly find comedones, white and black heads. We see this a lot in very young girls, sometimes in 11, 12-year-olds. So there is not much inflammation involved yet. So no papules, no risk of scarring. And here in this type, we do not need a laser treatment yet. We are still treating with mild cleansers and a little bit of seborregulative, ingredients, and this usually treats this type of acne well. The next stage is already quite severe. It's an acne papulopustulosa, so we have a moderate inflammation. We have a simultaneous appearance of a lot of inflamed papules, pustules, comedones, and scars are quite considerable in this stage. So this stage does really require an intense treatment, where we do use our Nordlys. I will show you that later. And the last and the deepest, the most severe type of juvenile acne is acne conglobata. So here we have a really large inflammatory deep nodules, papules, pustules. Usually the lesions are really sore. We sometimes see even abscesses that may occur and flow together, and scarring is very likely in this type of acne, and this acne does require a very aggressive and invasive treatment to mainly prevent scars and to stop the inflammatory process. So, as you all know, in adult, we sometimes also see acne. The most common type is acne tarda, so late onset acne, which we see in the age group of 25 to 45 years old, so beyond puberty. Mainly this adult acne is not so much related anymore to the overproduction of the sebum, but rather to hormonal disbalances. So here we should really look into the hormone profile and see whether we can adjust anything there with substitution. And so this treatment or this type of acne is also not so easy to treat, but responds, in my opinion, very, very well to Nordlys. So the next type is acne medicamentosa. We see this more and more in those bodybuilders, you know, so the anabolica acne, or also in steroid acne, in overdosage of vitamins, vitamin B6, B12 even. So usually you find this acne located rather on the trunk, on the back. So it has those usually very deep and painful pustules and papules, which guide us to the right diagnosis. The next one, acne estivalis. I had to mention this because in German, yeah, it's called Mallorca acne. Yes, so Mallorca acne, which is actually not a proper type of acne. It's a UV dermatitis, which appears after UV exposure, and which is a reaction to the free radicals with the lipids of cosmetics. So it can be treated very easily by just removing or skipping those topicals. And then we have acne excoriae. I'm sure you also have patients with this condition. They are quite difficult to treat, really. This is a picture of acne, which is rather, which appears from constant, compulsive scratching and squeezing and nibbling. This usually women are affected, and they are constantly, having their hands in their faces. They have to really scratch a lot on the skin, and they provoke their own scarring, unfortunately. And this is also a type of acne which can be treated well, but always remember the psychological, background in these patients. So if you look at the historical treatment approach, and we still experience this from a lot of patients who come to us, a lot of patients are still treated with monotherapy. So either with topical or with systemic monotherapy, so either with antibiotics, with isotretinoin, with BPO, HA, and no lasers. So this is something that is still very widely the standard theory, even the dermatologists, to treat acne. And I think we do have to rethink this, and we do have to be open to total new treatment approaches using lasers, especially the Nordlys. I'm going to show you how, because the results are spectacular, and we can really achieve super happy patients and with this and without any risk. So what is our treatment approach? I'm sure you all are familiar with the Nordlys SVT, which is a very special narrowband IPL technology, so which has special dual filters that achieve a high absorption in the target chromophore. So by filtering out the other higher wavelengths. So we achieve with this 2 absorption peaks. So what is the idea of the PR530? Why do we use it in acne? And it is, I can tell you, it's incredible when you do shoot on an acne lesion, on a papule, on an inflamed papule or papular pustule. You really see how the lesion is going to shrink, how we do have a change of color in the lesion, and how we do see an immediate improvement of the lesion without any side effects. So what seems to happen is, one thing is that we do seem to reduce bacteria, because we can see in our patients that we dramatically reduce the appearance, the texture of the skin, the appearance of the inflammation. So obviously it seems to reduce not only the bacteria but also pro-inflammatory triggers. We seem to reduce the sebum production, and therefore the inflammation in general. And this is what we are aiming for. So, and the next thing is, and I think this is something very new, is that we do combine the PR 530 with the FRAX 1550. So if you look at patients, let's say with an acne papulopustulosa or an acne conglobata, you can see that the texture of the skin is very flabby, that we see quite a laxity in the inflamed, in the scarred tissue. And the aim of the FRAX 1550 is to improve this laxity at the same time as we are treating the inflammation. So, and this is, I find this incredibly working well and quite revolutionary, because with this we can at the same time improve and work on the texture while we are still treating the activity and the inflammation of the acne lesions. So what is the FRAX 1550? This is one of the handpieces of Nordlys, which is a fractional non-ablative diode laser, which creates thermal coagulated microscopic zones in the deep dermis, and this leads to a collagen remodeling with quite a low downtime. Yeah, so the idea again is we induce dermal remodeling. We seem to prevent with this treatment combination acne scars, and we can also treat existing acne scars. I'm going to show you on some clinical cases how that works. So this is the take-home message for today. So what we are doing is the combination of PR 530 and the FRAX 1550. So it's a so-called multi-layer technique to reduce the inflammatory component of the acne, and simultaneously we improve the texture of the skin. If you look at the treatment protocol, where we're using the PR 530, it's pretty straightforward. And I must say, I don't really adjust this a lot because I personally find those settings working very, very well. So I usually start with the PR 530, 7 millijoule, 2.5 milliseconds double pulse, 10 milliseconds delay. So you just go on your display and put on the acne settings, or also pigmentation vascular settings. Sometimes I increase the energy from 7 to 7.5, maximum to 8, but I personally find that it's not really that necessary. And I always start using this white schablon, or template that Candela provides us, so where we can really treat the single spots, the single lesions of first. Yeah, so this is what I can recommend to you. Always start with the single lesions first before treating a bigger area, because we want to reduce the pain and the discomfort for the patient. And what you need to look for is you really need to watch the skin well. We are looking for a change of color. So we are looking for a change of a color change to grayish. Yeah, so this is our endpoint. And you can also palpate those papules and pustules, and you will see them melting. So you will see after 1 or 2 shots that the lesions will become smaller, and they basically start to melt. Yeah, when we recall our patients the next couple of days, they are always very amazed about the fast improvement of those lesions within a couple of days without any downtime. And then the FRAX 1550, we usually treat with this in the same setting. Of course, depending on the grade of inflammation. So if the patients have too strong inflammation and the skin is too painful, then I usually wait to the second or third treatment before we start with the frax. But if they tolerate it well, we already do combine with frax 1550 in the same session after IPL. So always PR 530 first and then frax 1550. So with this, it's also quite easy. I usually use the standard settings which the system gives us. So you just go on acne scars, which has a preset of 40 millijoule 4 passes with the 10 millimeter area, and this you can adjust to a smaller diameter or to a smaller width, of course. Yeah, and the treatment intervals are every 4 weeks for our patients. So how's the procedure done? I'm going to show you a very short video. We usually apply topical anesthetic cream. So we have a special formulation that we order at our pharmacy, which is 7% lidocaine, 7% prilocaine, and 6% tetracaine. We leave this on the skin for 20 to 30 minutes. And then the treatment, also thanks to the soft cool system of Nordlys, is really, really well tolerated. We have a moderate erythema afterwards, yeah, but I can show you now on the short video how it's gonna work. Yes, there we go. Yeah, so it's really short. Remove the amla cream, then apply the contact gel. Then we shoot with the 530. This is a fantastic ice cooler device that I can really recommend to use. Works super, super well. And then immediately after, we go on it with the frax 1550 4 passes. And this is followed by applying then a cool pad and a lovely calming mask before we send the patient home, and sun protection, of course. So let's go through some of our clinical cases. Here is a patient with papulopustular acne. She's been treated 3 times. I must admit she has been also on isotretinoin, 20 milligram a day for 4 months. And then we reduced the dosage to a really super low dose to 10 milligram a week even. And she's been treated 3 times with the combination of PR 530 and the frax 1550, and has a very nice outcome. Another patient, she came from a different dermatologist to us. She was already on isotretinoin 20 milligram as a monotherapy. She hasn't been advised to take any topical treatment and no lasers. So we started then with her. We did 3 sessions in total. And this on the right, you find the result after 3 months. And we have an incredible reduction of the inflamed lesions, and also a very good improvement of the texture of the skin. And this is something that our patients love, you know, they love the improvement of the overall appearance of the skin. The pores, they get smaller as well, you know, the skin looks more regular. Yeah, so this is a fantastic combination, I find. Yeah, here I show you another boy of 15 years old. He also came to us from another dermatologist, being on a monotherapy with isotretinoin. He has been advised also not to use any lasers. So I think this is something we really have to rethink. Yeah, we always do combine isotretinoin with the IPL and with the non-ablative fractional laser without any problem. So of course with the CO2 laser you would be more careful, and you know that would depend on the individual case. But with these, with the Nordlys, you're always on the safe side in combining it. And this is the result just after 4 weeks. So you see a dramatic improvement of the inflammation and also of the texture. Of course, he still has some acne scars that require further treatment, but he was very happy with this improvement after one session. And this was quite a difficult case, but I also would like to show you this. Sometimes it can take longer. Sometimes we go through quite a long period, with our patients before we see improvements. He had a really deep and severe acne conglobata, which has been associated with hypothyroidism that he had since he was born. We put him on isotretinoin 20 milligram a day, which he was on for 8 months, which is really long. I usually do much shorter courses than this, but in his case, it wasn't possible. And for over 4 months, he developed always really deep cystic structures, abscesses, which we had to open with a lot of pus in. So it was really difficult to treat him. And because all the skin was so painful, he wouldn't let us do the combination with the Frax from the beginning. So we had to start over 4 months with the PR 530 alone. And before we could combine, or we could add the Frax 1550, and this is the result now after 8 months. He still is in treatment with us, so now we are treating this the really deep scars with the CO2 laser, which I'm going to show you in our next webinar in May, which we will do with Barco Didac, where we talk about acne scars. But you can clearly see he has also a very good improvement and was really happy so far. So what are the advantages for our patients? And I think this is something I'm really excited about, because we do see fast results using the PR 530, especially. We can replace systemic therapy, especially in moderate acne cases. Also, acne tarda, by the way, is something that you can treat perfectly with the PR. We can also compensate the delayed onset of isotretinoin. As we all know, the first 4 weeks of treatment are a nightmare for our young patients. They, in about 50%, they even experience a terrible breakout, and we need to help them and need to motivate them through this 4 weeks. And for this, the PR is fantastic to use. Yeah, so we also refine the skin texture and the pore size. We prevent scarring, and we treat the existing scars with the Frax 1550. Of course, as we all know, the 1550 has certain limits when it comes to very deep scars, but you will see what matters to these patients is more the appearance, the improvement of elasticity, the overall appearance of the skin, than the single scar. And also, what I would say, we have no painful medical deep cleansing, so we don't do deep cleansing treatment anymore in our clinic. So I immediately start with the laser treatments, and I must say the patients are a lot more happy. We have less painful acne, treatments, deep cleansing treatments, and so I only see benefits in this concept. Besides this, I think what is important when we treat our acne patients, and I think this is something we really have to look into. Teenagers, they are in a very difficult phase of their life, and they do need our support. Yeah, so we really try to build up a good relationship to them while they are undergoing this treatment, which always takes a couple of months. I mean, we have no miracles. It takes the time it needs. Yeah, but in this time we do our best with the Nordlys and with the combination treatments And but of course, they need to learn how to use their daily skincare, which skincare is appropriate for them, how to deal with makeup. So we really try to teach them also in these matters, because I think this is so important, and this is part of the whole acne concept. Also, a healthy diet. So as we remember, acne is an inflammatory dermatosis. Yeah, so which means any sugars, any carbohydrates that we eat, they work like a explosive, agent, and can not provoke acne, but can make acne worse. I mean, usually the teenagers, they realize that, when they prepare for the exams, when they have parties and had a lot of junk food, that the acne flares up more. Yeah, this is very often related to a not so healthy diet. So this is also something we should help them and advise them. And skin protection with SPF, of course. I mean, treating or working on Mallorca with 300 sunny days per year, we have to advise all our patients about the importance of SPF. Of SPF 50. So we treat all year long, even in the summer months, with lasers, also with isotretinoin. But of course, people have to be protected well. Yeah, and we have to constantly motivate the patients, on their path of recuperation. And I must say, we have so many really happy patients with this concept that I know we are doing it right. So what are the advantages for us? We also are happy with great results. We have good compliance, even with the teenagers, with the youngsters. Yeah, so we have really satisfied young patients, which are the future for our practice. And of course, economically, also it's interesting if you use the laser a lot. It has a good cross-selling potential as well. So what are our conclusions? Lasers and IPL are a really important integral part of the modern acne therapy for all age groups, not only for adults, also for teenagers. They are really potent with only very few side effects. Yeah, so this is something that you can really be aware of. You won't have many problems if you advise the patients right, how to use SPF, of course, and how to use the laser right. And it's not necessary to go always up to the highest energy. The settings that we have with Nordlys are wonderful. Yeah, we have a high compliance among our patients, and the new treatment approach that we are using is the combination of the simultaneous treatment of the active acne, of the inflammation, and the treatment of the scars, or preventing the scars or treating the existing scars at the same time, and this saves us time. Thank you very much for your attention.